Shahnawaz, Senior Physician from Srinagar, UT of J&K. Today I'll be briefly talking about latest updates in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to CVD, which affects 45% of people in age group of 40 to 69. Raised blood pressure is among the most important risk factors for cardiovascular diseases. Moreover, it remains poorly controlled due to low awareness about hypertension and lack of appropriate care. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of people, that's 51% of men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of men and 53% of women living with hypertension did not get treatment. International Society of Hypertension has released 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource-poor settings. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource settings. The AHA-ACC has released a scientific statement in 2021 offering new guidelines for management of stage 1 hypertension among patients with low ACVD risk. Among low-risk adults with stage 1 hypertension, that is systolic between 130 and 39 and diastolic between 80 and 89, management starts with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacological therapy. And a recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to 110 to less than 130 millimeters of mercury range substantially reduced CV adverse events in STEP randomized trial, affirming the sprint findings for an older Chinese population among 8,500 patients aged between 60 and 80 years in China. The intensive target trimmed 26% of the composite CV risk, findings from now a second major trial supporting lower targets. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European Guidelines on Management of Arterial Hypertension recommend that diagnosis of hypertension should not only be dependent on office BP measurement, but also on out-of-office measurements such as ABPM or home BP pressure monitoring. 24-hour and nighttime BP measurements were associated with greater risk of mortality and a composite CV outcome. The risk of mortality increased by 23% and risk of cardiovascular event by around 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. 2018 European Guidelines equally recommended 5 classes of antihypertensive drugs, considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, 2018 guidelines, especially in the context of lower BP targets, to start antihypertensive therapy with an initial dual fixed dose combination of ACE inhibitors or ARB plus calcium channel blockers or diuretics. Since early July 2018, products containing valsartan have been recalled worldwide. The reason, the detection of known carcinogen, namely N-nitrosodimethyl amine, otherwise NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by WHO International Agency for Research on Cancer to be carcinogenic in humans. The HYGEA study represents the largest study that tested nighttime antihypertensive treatment in trial. Chronotherapy was associated with a significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study included a total of 19,084 hypertensive patients. During an average follow-up of 6.3 years, 1,752 participants experienced a primary CV outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP differing during sleep. The RR reduction for cardiovascular events was significantly improved for nighttime treatment when it was compared with the awakening treatment. Thank you.